Alright, okay, so hello dears! Ayan, and welcome back again to the second part and the continuation of our lecture on the serology of other infectious agents. And for this lecture, what we're going to discuss now are the viral agents, other viral agents, and their serological tests and diagnosis. Alright? And we'll start first with your rubella. Okay, so mga ano siya, trip down memory lane sa inyong virology. Yes, mga war flashbacks. Alright, so we'll start first with rubella. Rubella is also known as your German measles. So it's the positive agent of your German measles. It's an envelope, single-stranded RNA virus of the Togaviridae family. Ayan. So, again, siya nag-cause sa German measles. Alright? Do not, lahi ang cause sa German measles, lahi po ang cause sa measles rat. Alright? So, please take note of that. Alright, so for rubella, it's German measles or your 3-day measles. But again, thankfully now it's part of a vaccine. No? We have a vaccine for rubella now. So it's quite controlled. But before immunization, the viral infection occurred in childhood, even also affecting adults. Okay. Now for mode of transmission is through respiratory droplets. Okay, so inhalation of the respiratory droplets. Okay. And it's endemic to humans. Alright. Signs and symptoms, they vary widely from person to person and may not be noted in some cases, especially if the rash is light. So its characteristic is na siya rash na ma-develop. Okay, rash. Okay, rashes. Okay, na ma-develop. Okay, and we have two types of infection that's important. The first is acquired rubella infection, which is usually what we experience as adults. Alright, so incubation period niya is about 10 to 21 days. Alright, so medyo mataas. Alright. But 12 to 14 days is difficult. Okay, and a patient having rubella is contagious for about 12 to 15 days, beginning 5 to 7 days before the appearance, if naamaganing of a rash. Okay, na iba na walay rash. Okay, walay mga rashes. Okay, and acute rubella infection lasts from 3 to 5 days and generally requires less minimal treatment. So, makaya na siya sa body. Okay, self-limiting. Most of your viral infections are self-limiting, meaning it can resolve on its own. Dili na kayo need ng mga intense na treatment. Okay, that's some. Most of your viral infections, but some really can progress to mga lifelong ano, diba? You already know that. Virology, yes. Okay, alright. Ayan. Now for the manifestations in acquired rubella infection, of course, catarrhal symptoms, so mga fever, no? Mag-init yung paminaw, whatever, fatigue, and followed by the involvement of the retro-auricular, so sa likod sa ears, posterior cervical, dire, and post-occipital lymph nodes. So, post-occipital lymph nodes. Occipital lymph nodes. Basta lymph nodes. Alright. And finally, emerges of a maculopapular. So, meaning dagko or nagdugol na mga rash. Maculopapular rash on the face and then sa trunk and sa neck. Okay. Alright. So, this is an example of a rubella rash found in a patient, baby. Ayan. So, as you can see, the rash, okay, quite mga dugol sila. So, muna siya difference niya sa chickenpox. Ang chickenpox, ang rash niya kay medyo lagyok niya mas dagko. And sometimes the rash sa chickenpox, kaya pwede magka-blisters, magtubig-tubig. No? So, I tried that before when I was a kid. Yes, medyo very itchy, as in like intense itchiness. Okay, alright. Ayan. So, this is the rubella rash found in a child. Okay. Now, for immunologic manifestations, for IgM, it's about detectable a few days after onset and will peak siya at about 7 to 10 days. And the presence is suggestive of a recent infection. And for IgG, will increase na siya about 7 to 21 days. And the presence in dilutions of patient sera for dilutions higher than 1:8 is indicative of past infection with rubella. Okay, alright. That's for acquired rubella infection. So usually for adults or mga children. Okay. Now, the other type of rubella infection is congenital. Congenital rubella infection is really devastating. It can cause very devastating effects for the newborn or for the infant. Okay. Aside from the causes that it can cause stillbirth, diba? It can also cause congenital malformations. Example, encephalitis, hepatomegaly, bone defects, etc. Mental retardation. So a wide variety of congenital malformations. If a mother contracts rubella while she is pregnant. Okay? Alright, so here's an example of a baby, so cutie, a newborn with rubella infection pag panganak pa niya. So, dili kayo evident iyang malformations, but na siya malformations. Okay? Congenital malformations. Alright. And for immunologic manifestations for congenital rubella infection, we cannot distinguish between IgG of the maternal or fetal origin because your IgG can cross the placenta. So if you test the newborn's blood and it's positive for IgG, rubella, if it's positive for IgG and rubella, you cannot distinguish if it's from the mother or from the baby himself or herself. Because again, the IgG antibodies can cross the placenta. So what we do is we test for IgM because this is diagnostic of congenital rubella syndrome. So if the baby, you test for IgM, the rubella, and it's positive, then it's diagnostic of congenital rubella, okay? And for newborns, the testing should continue even until the first 6 months of life, okay? Para ma-detect yun for newborns, especially if wala dili pagpanganak, na wala rin mga rashes or whatever. So to really detect or to really check if wala na ba siya rubella, you continue to test it for IgM until the first 6 months of life. Okay? Alright, ayan. Now for serological diagnosis for rubella, rubella is a part of a group of diseases known as your torch. I'm sure I hope na mention it sa video, but torch is a group of diseases that usually these are called your congenital diseases. Okay, these are your congenital diseases. The diseases that can infect or that can affect your fetus, the developing fetus inside the body. All right, of the mother. So that's torch. T stands for toxoplasmosis. O for other viruses. R for rubella. C for cytomegalovirus, and H for herpes virus. And among the diseases mentioned, CMV, please take note, cytomegalo is the most common. Ako lumalabas sa words. Most common congenital disease. Okay? Na pwede ma-transfer or makuha sa baby or sa fetus. Kung sa'yo pinaka-common, CMV. Okay? CMV. Among the torches or sa torch na agents, CMV ang pinaka-common. Alright? Okay, please take note. And here are some of its testing methods, including the torch ng mga agents. For torch antibodies, again, we detect both IgG and IgM. For rubella, we use either chemiluminescent immunoassay that can detect both IgG and IgM. We can also use mga kits, immunochromatographic assay, which detects IgG, and we can also use IFA, indirect immunofluorescence assay. And it detects monoclonal antibody to rubella, mga virion proteins, E2 and C. So these are mga virion proteins sa rubella. Okay. Alright, so these are some of the testing mechanisms. Chemiluminescent immunoassay, rapid test, immunochromatographic, or your immunofluorescence, indirect immunofluorescence assay. Okay, so that's for rubella. Very important siya for babies, congenital transmission. Kaya muna siya na devastating effects, as we have mentioned, in the previous slides. Okay? Alright. Now we go now to the next viral agent, and that is rubeola. Ayan. So do not be confused, rubella and rubeola. For rubeola, this is now the positive agent of your measles. Ayan. So measles, caused by a single-stranded RNA virus, different family na, Paramyxoviridae, alright? And it's on the genus Morbilli virus, okay? So Paramyxoviridae family. For mode of transmission, it's very highly contagious, similar with your similar mode of transmission with your rubella. It's through respiratory secretions, alright? Respiratory droplets. It's highly contagious because humans are the only known reservoir of the virus. Okay, so wala na ilain. So humans na yung ma-infect, humans na yung ang pwedeng ma-apektuhan. Okay, so very, very highly contagious. Okay, so muna na yung mga outbreaks, very common outbreaks. I remember when I was still an intern in Bohol. Bohol ba yan? I think sa Cebu na. I think 2019. I think it was 2019 or 2018, but there was a recent Mumps, measles outbreak. I think 2018, not so Bohol. I forgot, but there was a recent measles outbreak, mga 1 or 2 years ago. Yes. Yeah, measles outbreak. Because again, they're it's highly contagious. Alright. But it can be prevented using your MMR vaccine. Measles, mumps, rubella vaccine, diba? 3-in-1, no? Diba? So, very, very important dyan ang vaccination. Because I think that was the time na nagka-measles outbreak kay basin, wala na kayo na-promote ng MMR vaccine, but MMR vaccine can really prevent, okay? Can really protect the babies, usually babies and children, from your measles, mumps, and rubella. And this should be administered to 12 to 15 months old, so 1-year-old to 1 year and 3 months old na mga children, and continued until between 4 and 12 years of age, okay? So, because it uses a live attenuated vaccine, so meaning it's a live virus of MMR, pero it's medyo weakened, okay? It's attenuated, Okay, alright. So when I ask your parents, dears, if you are vaccinated ba? When you were like completely vaccinated ba mo? When you were still a child or when you were still a baby? Ako, I forgot. I don't know. I don't know talaga if I'm completely vaccinated. Hindi ako mahal ng parents ko dyan. But I think I am naman. So, it's best, Jude, that if you have kids in the future, if you have babies, no, if you have kids in the future, children, if you have plans on having children, if wala pa po din, okay lang yun, oh my gosh. Okay, if you plan to have, then of course, make sure that their vaccinations are up to date. Medtex mo, oh my gosh, it would be such a blow on your faces there. So, hindi mo magpa-vaccines yung mga anak, nako. Okay, as in, ano dyan tamo? Promise, ano dyan tamo? I-pressure tamo sige. But anyway, yes, it's good that children are well vaccinated. Okay? Alright, your MMR vaccine, one of the best preventions for measles, mumps, and rubella. Okay, vaccines work. Nako, sinasabi ko talaga. Mga anti-vaxxers dyan, mga Karens. Charot. Okay. Alright. Now for Lab DX, still the same. We detect measles-specific IgM for serology. We can also use molecular methods, RNA, nucleic acid amplification from clinical specimens. NPS, nasopharyngeal swab, oropharyngeal swab, OPS, naso-oropharyngeal swab, throat washes, or pwede rin sa urine. Okay. So this is an example of your measles rash. As you can see, red siya na medyo lupol ang rashes. And this is what we call your cochlear spots, pathognomonic sign. When you say pathognomonic, dears, it means, it really points, pathognomonic means this is the sign or this is something that can really point to the disease. Meaning, if any siya present, it's really that disease. Parang it's really pathognomonic, it's really definitive for this disease, okay? And for measles, yes, is your cochlear spots. Mga white spots inside the mouth of a patient with measles. Ako, press the buzzer. Cochlear spots. Okay, sana na-remember pa sa Viro. Yes, war flash. Joke. Okay, pathognomonic for measles, cochlear spots. Okay, alright. Now for your serological diagnosis, still the same. For antibodies, we can use ELISA. Alright? And atong gold standard pa rin is cell culture and immunofluorescence. Okay, from these specimens. For ELISA, you can use IgG and IgM, which is semi-quantitative. And you can also use IgG or IgM, IgG in the CSF. So it depends on your need. No? It depends on the specimen then. Because your measles can have, if hindi siya maagapan, pwede siya mag-progress sa CSF, pwede siya makakause ko subacute sclerosing panencephalitis. Okay, so this is an inflammation in the brain. That's why CSF is included sa mga specimens na pwedeng i-test for measles, di ba? Subacute sclerosing panencephalitis. If I'm not mistaken, check to I think. As in, dears, no, you know, after board exam talaga, knowledge, if dili ka masintuon, may mawala din siya. Like me, I'm there, nagkabugo na gito. But anyway, yes, laban lang ka. Alright. So, when you graduate, if mo work na mo, always learn pa rin, ha? Like, review your notes, review your lessons. It really helps, okay? Especially if you practice mas medtechs. And in the medicine field, then if you become doctors, and if you proceed to medicine, very helpful that you review what you know. If na, I don't know. If na, you remember, charot lang. Okay, of course naman na, my gosh. Okay, alright, ayan. So that's for rubiola, for your measles. Okay. Now, yeah, okay. Alright. So these are different methods and iyahang mga comments or like asa siya ginagamit. Again, this is from third one. Okay. Alright. Now for the next virus, this is of course your mumps. Okay. The third part of MMR. Okay. Your mumps is of course caused by a virus, mumps virus of the same family with rubiola, parang mixovirinae, but different genus. Rubiola virus na siya, ang mumps. Now mumps, mode of transmission is still direct contact, respiratory droplets, saliva, even fomites. So fomites are inanimate objects, surfaces of table, cell phone, whatever, that you can get the virus from or you get the pathogen from. Fomites. And replicates initially in the nasopharynx and regional lymph nodes. That is why the spectrum of disease are very popular niya is of course inflammation of your parotid glands here, diba? Of your salivary glands or parotitis. So, muhubag, increase in size. Aside from that, it can spread to the meninges of the brain, salivary glands, pancreas, and testes. Ayan, that is also known as orchitis, inflammation of your testes. It can also go to your ovaries and produce inflammation at those sites. And this is your parotitis, yes. If you're a fan of one of my favorite shows here, Brooklyn Nine-Nine, yeah, you remember this episode. Si Simon and si Balthazar. I hope you remember sa mga B99 fans dyan. But anyway, yeah, this is parotitis. That is why it's mentioned that if you're a male and you have experienced mumps, no, it's very scary or dangerous for males because it can also affect your testes, alright? So, it can lead to, in a way, infertility, diba? So, na-remember ko na, sige, nakatry mo mag-mumps, sige, try if mag-mumps ka, if sa mga males, diba, if mag-mumps ka, init po sa imong ilan. Alright, init po daw here sa imong sa hubag, init po daw sa imong scrotum, sa eggs. Because yeah, that could make sense. Because again, it can spread to the testes. That's why for males daw, it's very dangerous na magka-mumps mo. Okay, magka-mumps ka. Magka-mumps ka because again, it can affect our testes, can lead to infertility. Alright. Okay. Ayan. So again, that's for mumps. Can lead to infertility and parotitis. Most common clinical manifestation. For diagnosis, again, mayroon clinical symptoms. If klaro na kaayo sa mumps pa lang, sa butot pa lang dire, so you can already point na that's mumps. But if not, culture, gold standard, molecular and even serological tests. Now for your serological test, we look for the presence of mumps-specific IgM. If it's present, then that means current or recent infection with mumps, or a fourfold increase in IgG, so from acute to between versus acute and convalescent na sera. If there's a fourfold increase in the titer, then that's positive for a recent mumps infection. And for IgG antibodies, they become detectable within 7 to 10 days and persist for years. So different methods: ELISA, the most commonly used method to detect mumps-specific antibodies, and we also use solid-phase IgM capture assays because it reduces the incidence of false positive caused by rheumatoid factor. So kabante na mo, RF, rheumatoid factor, is really a nuance. Dagan kayo siyang i-affect, no? Pabibo kayo siya, like sige siyang ganahan na siya. Okay, ganun. May mga friends ba kayo na rheumatoid factor dyan? May kilala ba kayo? Okay, alright, ayan. So that's for mumps. Serological test, ELISA and solid-phase IgM capture assays. Again, more on detecting the antibodies rather than the antigens. Okay, alright, and that's for mumps. And we go now to the last viral agent, which is again the very common, very prevalent in the world and in the Philippines, dengue fever. Okay, dengue fever is caused by again dengue virus, and dengue virus is considered to be the most prevalent arbovirus in the world. Ayan, so recall sa mga meaning sa arbovirus. Ako lumabas sa boards namin. Okay, ayan. Arbovirus number 1, micropara. Sa ako ang set sa board exam. I remember it so well. The following are arboviruses except. So when you see arbovirus, again, recall lang sa inyong biro. Arbo stands for arthropod borne. Arthropod borne. Arbo. Meaning, these are viruses that can be transmitted through arthropods. Insects, vectors, okay? So sa ako ang board exam, that was a recall. I mentioned this sa ako ang public health students before. That was a recall. Nigawa sa akong board exam. The following are arboviruses except. Ang choices, dengue, Zika, chikungunya, and last is CMV. So what's to answer ato? Nako, dapat press the buzzer na. It's CMV. CMV cannot be transmitted by arthropods, okay? The rest, dengue, chikungunya, Zika, they can all be transmitted by mosquitoes. Alright? Ayan, ako, lumalabas sa boards. Okay. Alright, and dengue, again, virus, the most prevalent. The most prevalent arbovirus in the world. It's a single-stranded, positive-sense RNA virus, 4 serotypes, 1, 2, 3, 4, of the flavivirus na genus. Okay, Flaviviridae na family. Okay, alright, ayan. And mode of transmission, again, bite of your mosquito, Aedes aegypti predominantly, pwede rin Aedes albopictus, yes. mga public health, yes. Recall, mga war flashbacks ba? Ganun. Okay. Mga pagpisa sa larvae sa mosquito, yes. Alright. And signs and symptoms, high fever, headache, rash, back and bone pain that lasts 6 to 7 days. So now back and bone pain. That is why dengue fever is also known as your break bone fever because you feel like your bones are breaking, parang ganun. Or painfully mukhang kalawasan, ganun. So break bone fever, also known as your dengue fever. Other name of your dengue fever, break bone fever. Okay. Spectrum of disease, severe forms can cause dengue hemorrhagic and dengue shock syndrome, especially if these are seen, especially if you are infected with dengue, but of a different serotype. Meaning, nagka-dengue na ka before of a different serotype. Let's say, nagka-dengue ka of serotype 1 na virus. And then, nagka-dengue ka also, this time, serotype 2. So, lahi na po na serotype. Because of that, no, it can lead to severe forms such as dengue hemorrhagic and dengue shock syndrome. Why? Because of the antibodies produced by your initial dengue infection, a non-neutralizing antibody. Because of that, it promotes the uptake of your cells of the virus. And this uptake of the virus can trigger your memory T cells to become activated. Okay, and when your memory T cells become activated, they then trigger the release of cytokines, inflammation. And in the case of the cytokines, inflammation, it can lead to a hyper state of cytokine. Diba? That can lead to a cytokine storm, which is one of the, not only in dengue but also in COVID-19, one of the mga detrimental effects of too much triggering of your immune system. Cytokine storm, intense ang imuhang pag-release of cytokines. And when this occurs, it can lead to the weakening and rupture of your vasculature and can lead to internal bleeding and loss of plasma, which then leads to dengue shock syndrome and hemorrhage or internal bleeding. Diba? So that is the downside if you get reinfected with a dengue virus of a different serotype. Ayan. So, muna siya yung pathology or pathogenesis. Because there was a question before, I think, not board exam, but a friend of mine, during sa review season, taga-Olfu siya, or Lady Fatima, he asked me, bakit daw, why is the second infection of dengue much dangerous? It's because of this. Okay, so akong i-share ninyo ang pathology. Okay, I found this out on a microbiology book, Medical Microbiology by Murray na book. Okay, really good book. Alright, so ayan. So that's for spectrum of disease. For treatment of dengue, there are no known antiviral agents. Ang treatment lang yun is supportive. Like, go, kaya mo yan, joke. Treatment is supportive, like bed rest, fluids yun, hydrate. Ano siya important sa dengue. And vanilla ice cream sa lingkap, okay. Alright, yeah, bed rest and hydrate. Fluids yun ang important, okay. Alright, because again of this probable reason, plasma, mag-release of plasma, so wala na kay fluids, diba? So you need fluids, you need to replace the fluids that were lost. Ayan. Okay, dengue is really deadly. I've experienced this in my Soto internship. In Galiares, there was dengue outbreak. Grabe, like, I remember when I was in Soto, emergency room ko na duty and then phlegm, and ER sa Soto is like intense. Intense yun. And then there was this one time na nag-phlegm ko kanina patient, and then nakapara ko dugo, baby to siya. And then tapad na ako as a child suffering from dengue. So first round na ako of first warning na ako katong patient kay okay pa. Then pagbalik na ako dito kay after a few minutes kay gidabang na siya. Kay enlarge niya yung tiyan, and then nag-cause to siya bleeding. And then after a while kay gidabang siya, and then eventually namatay ang bata. So inanakadadli ang dengue. That was my experience in Soto, Galiares. Basta aside from public hospitals, you get to be more exposed to reality, especially sa mga poor. It's really saddening. It's really and makasad na makalagot na you know that the healthcare system here can be well improved lang yun if the people in power are focusing, are more open, are more aware of the importance of healthcare system and the importance of a good and functioning healthcare system to the well-being of the country. But sadly, we don't have that here yet. Sana naman. Okay, so yes, so if my intern mo po, Galiares Soto, send my regards to my RMDs. Char lang. Okay, I miss them, but but I'll see you there siguro. Charot, okay. And yeah, you'll get to be experienced. Murang, ano lang yun, ano na daan, kanang warning lang daan, no? It could be gruesome, ganun kayo kang makita dyan dito ng mga, like, ha, it's happening to the eye, like, grabe dyan kayo ang situation. So, yeah, ano lang, ready lang, prepare lang, okay? Alright, okay. Okay, daming chika dahil sa dengue. Okay, so that's for the introduction for dengue. And since, of course, it's very common in the Philippines, similar with leptospirosis. So, a little statistics lang. In 2021, very good statistics because there is a 32%, 70% pala, decrease in the cases compared to the same period in 2020. So that's really good. Because I remember on August 6, yes, the country declared a nationwide epidemic of dengue. I remember August 6, 2019, I was still in Manila reviewing for boards. Hapitali for boards the August 6, 2019. It was an outbreak. And until the end of 2019, about 400,000 cases were reported. This was an outbreak. I remember talking about this in my class in public health, in my first class in public health. I remember it so well, dude. I remember it. These mga chika. Yeah, I remember it. I was still in Manila back then, so that's 2019. But now, so far, there has been a decrease in the rates in dengue, cases in dengue, so that's good. That's really good. But it still remains to be a public health concern in the Philippines. All right, so it needs to be addressed. Many things about dengue still needs to be addressed talaga. So, and it's not a disease that can be joked about or it can be brushed off because it can cause lives. It can lead to death. Okay, so ayaw dyan na siya sayo na ang dengue kaya makamatay na siya. Okay, because I remember, ang dami kong chika, no? But I have friends magod na recently lang with okay, because of this COVID-19 and dengue, same silang symptoms in a way na masakit yung lawas, kapoy, and then mag-fever ka. And then I have this friend, two friends yata, na inanay na symptoms, and then, so nakuya mo na sila na COVID ba or something. But then pagpa-check nila kay dengue ra, so ilang reaction kay, yes, dengue ra. So yun ako naman, ha? Nalipin mo na dengue na. So, gets ko sa point na dili COVID. But, still the same, dengue is still deadly. So, there's nothing to be happy about or to rejoice about. So, pero sige lang, kagets ako na nag-rejoice sila kay dili COVID. But, anyway, wala lang, naligaw ako sa ilang reaction. Anyway, wala akong chika. Alright, ayan. So, that's for dengue fever in the Philippines. Okay, now we go now to your laboratory diagnosis and tests. First is we either detect viral component, we detect the viral genetic material. So we use again RT-PCR or we detect an antigen, which is your non-structural protein or NS1. Your NS1 non-structural protein is a protein in the virus, no? Structural protein siya. Right now siya sa inner parts of virus. That is usually released during mga infection, acute infection pa lang of dengue and during active replication of the virus. So in the presence of NS1, we'll encounter that later when we go to testing sa dengue. The presence of NS1 usually indicates mga recent infection or sugod pa lang sa infection. Because again, NS1, non-structural protein, meaning sa NS ha, non-structural protein, NS1 is released during active replication or initial infection sa dengue. Okay? Alright, ayan. And aside from viral component is of course serologic testing. We test IgM by ELISA or lateral flow methods and IgG by the same methods, ELISA or lateral flow methods. Okay, alright, now we go now to the first test. This is from CDC. Your IgM antibody capture ELISA assay. Alright, your MAC ELISA. Nanap yung MAC? Charot. Okay. My gosh, it's haunting me. Charot. Okay, alright. Our principle is of course by the name itself. On a microtiter plate, you have IgM antibodies that's attached to it, and it captures your human IgM antibody, and then after niya makapture ang antibody nimo against dengue, adan mo siya antigens to dengue, and then imo na pong adan og enzyme labeled na antibody. So it's a capture assay, all right? Ayan. And the specimens will be serum or CSF. The results, dagan kayo siya interpretations. If positive ka, then it could indicate a presumptive recent dengue virus infection. But if it's negative, if you have been tested before day 8 of the illness, and then nagpa-test po ka og NAAT or nucleic acid na test, NS1 test, negative ra, it's considered to be unconfirmed. And you need to retest before day 7, after day 7 of symptoms for additional serological testing. So, ni-test ka, ni-positive ka for, negative ka for IgM, ani na method, before day 8 of illness, like day 5, day 6, and then negative pa siya kag NS1 or NAAT, nucleic acid test. So you then retest after 7 day, after the day 7 of symptoms. Okay? Next, if negative gyapon, after 7 days of symptoms and negative pa siya ang NAAT, then you are considered negative for recent infection. But if there's a change from negative to positive IgM results in paired samples. Ang first sample we collect during the first 7 days of illness, and second sample is collected after symptoms subside, then you are considered current, you have a current dengue infection. Okay? So, meaning there's a change. Meaning, ni positive, ni negative ka ato muna, pero ni positive ka after pag-test sa imong sample sa symptom. Pag-test sa sample, nagikuha after sa imong symptoms. So, ni positive ka, so you're considered a current dengue infection. Okay, so here's an example of your MAC ELISA. Okay, so again, antibodies muna, solid phase in your microtiter plate. You then add your serum, again, that contains the IgM. So, i-capture na siya sa imuhang antibody. Then after, you then add the DNV antigen, dengue virus na antigen, and then you then add the enzyme label, okay? And then you check for color change. Okay, so that's for the MAC ELISA. Alright. And IgM antibodies for dengue usually are detectable 4 to 5 days. 4 to 5 days after symptoms. Okay. And yeah, and they are detectable until mga 12 weeks. Okay. So 4 to 5 days after symptoms, ma-detect ang IgM and can be detected until 12 weeks. Okay. Alright. Okay, so we continue to the next test, which is your plaque reduction neutralization test, or your PRNT. Now, usually this test is usually performed now by mga reference labs, high-end labs, because again, this test, it detects specific neutralizing antibodies against your dengue and other flaviviruses. And this is usually performed to detect, to be more specific talaga, what is causing the patient's IgM antibodies, or what is the source, Is it really from dengue or from other flaviviruses like yellow fever, Zika virus, and even to some extent to determine if what serotype ng dengue ang naha. Alright? Okay. The principle is again, you incubate the virus with the patient's antibody, and because of that, the virus will be inactivated, hence they cannot able, or they are no longer able to replicate and infect in cell culture. And specimens again still can be serum or CSF. So here's an example of a plaque reduction neutralization test. As you can see, the white dots are the plaques, meaning these are plaques these are the virions that we're able to grow, alright, or that we're able to infect. Okay, alright, so the lesser the white ones, meaning the less virions na ni survive. Okay, alright, so muna siya, PNRT. Again, used for complex session na test, performed mostly in mga reference labs. Okay, and in the purpose again, to precisely determine the cause of infection in IgM patients. Is it really from dengue or from other flaviviruses? Okay, alright, so that's for plaque reduction neutralization test. And the next test is very common, and it's a test that I learned na lang in internship because it was not discussed in my third year. So, karon ako na siyang i-discuss para di na mo ma-shoot sa internship, is your dengue duo test. Your dengue duo test is actually parang siyang brand, but it's what we call, or what the laboratories have. It's your dengue duo test, and the principle is immunochromatography. For dengue duo test, because by the name itself dengue duo, because it detects both already the NS1 antigen and the antibodies to dengue. So duo na siya, 2 in 1, eating 2 birds with 1 stone, ganun. Okay, so you're detecting both the NS1 antigen and the IgG and IgM. So immunochromatography, I think you already know the principle, but for you to understand pa good, so illustration ulit. So again, NS1 antigen. So for the test band, it contains a mouse anti-NS1 antigen, and for the control, it contains goat anti-mouse IgG. Again, depending on the manufacturer. Alright. Now for the sample, let's say it contains your NS1 antigen. So pag add mo sa sample, it then binds to an anti-NS1 antigen gold colloid conjugate. Alright. So this one, right, waiting in the sample port na pit sa inner part sa mong kit, and of course they will bind and they will be captured by the mouse anti-NS1 antigen. And of course, this will lead to the production of a colored band on the test region. And of course, our control will collect or will capture the remaining unbound ng mga gold colored conjugate, and of course, still producing a colored na band on the control, diba? So again, immunochromatography, this is dengue duo test for NS1 antigen. Now for the antibodies, ayan, so either IgG or IgM. For the test system, depending on the antibody, for the test system for IgM, it contains a mouse anti-human IgM and here a mouse anti-human IgG. Okay. Now on the control, both of them contains rabbit anti-dengue IgG. Okay, so it is for the capturing of the antigens. Because here we have a recombinant dengue virus envelope protein. So it can detect a lot of serotypes actually because it's a envelope virus, envelope protein of the dengue virus. So it can detect a lot of serotypes. Kay recombinant siya, so murag i-incorporate ang the rest of the serotypes. So munang mas ma-detect niya ang antibodies to all of the serotypes sa dengue. Okay, so recombinant dengue virus envelope protein, gold color. Now let's say your sample, again either IgM or IgG. Of course, they will bind with this. The triangle is the envelope protein now, of course. And they will be captured by the test system, and of course leads to the coloring of the test band, similar with your IgG. And of course, the remaining unbound na mga recombinant dengue virus protein, envelope protein gold color will be captured by your mouse anti-human, rabbit anti-dengue IgG. Okay, and of course that will lead to the coloring of your control band. Okay, so that's for immunochromatography sa dengue duo. Now for the results. We'll start first with this. Ayan, what is that? Of course, it's a negative result. No dengue virus, no NS1 antigen or IgG, IgM is detected. So it could indicate that the patient is free from a dengue infection. Alright. Next, we have these two results. Of course, wala yung control line in either. That is considered to be an invalid result. Again, basta ganit test kits, always make sure that there is a control line. Alright? And if in any result, retest using a different assay, using a different test kit. Basin guba ang test kit. Alright? Or expired na ba? Alright. Right. So that's for the test results first. Now we go now to your NS1 antigen results. Again, antibodies pa pala, sorry. So this one, control lines NS1, and there's a control line in M, that's an IgM positive, NS1 antigen negative. So that could indicate a recent primary infection. Next, you have a control line on the G, that's IgG positive, NS1 antigen negative. A red line, sorry. So it's a recent secondary or past infection. And lastly, both the G and L have, so it's have lines or red bands. So it means IgG, IgM positive, NS1 antigen negative. It's a late primary or early secondary. So meaning, late primary, nagkagamay pa ang IgM pero naagyam. And then padulo na taas ang IgG. Okay? And early secondary, it's because secondary infection na naman. So, may-increase siya pa ng IgM, okay, secondary. And then of course, nagyan pa ng IgG because of the primary infection before, diba? Early secondary, okay? Alright, ayan. So, that's for the antibodies, IgG, IgM na interpretation. Now, next, we go now to the NS1 antigen. Again, NS1, non-structural protein. It's an antigen produced by the dengue virus in active replication. Okay, all right. So it's released in the serum. Okay, during active replication of the virus. So first result, ayan. So it's NS1 antigen positive. None of the antibodies present. It could mean that it's still early in the onset, day 1 and 2. So NS1 antigen is at the highest concentration, 1000 mg per ml. Alright. Next result is of course NS1 antigen positive, IgM positive. This is about 3 to 5 days after onset. NS1 is still increased, no, it accumulates, but IgM starts to be positive now. Alright. And lastly, as you can see, NS1 antigen positive, IgG, IgM positive. It means that your NS1 is now decreasing in value or in concentration, but it's still there. And IgM is still increasing, alright? It's still increased, but IgG starts to be positive now. Now, as you have noticed, walay NS1 antigen positive and IgG positive. Why? Because if there's already IgG, alright? There's IgG already, the NS1 antigen will be neutralized. Mawala na yun siya. Kaya mo effect naman ang IgG antibody against your NS1 antigen. So for the long run, mawala na yun ang NS1 antigen if IgG is positive na. That's why wala yun na result. NS1 antigen positive, IgG positive. Okay. So far, sa ako mga gipang research ha. But in practice, wala ko remember na NS100 siya IgG positive. But I think pwede siya, no? But based on my pag-search na ako sa results sa dengue duo, okay, mura din ang gawas. Alright? Okay, ayan. Kaya usually after ani, ang next na result is katong IgG positive na. IgG positive na lang. Kaya siya na may persist for years for immunity. Okay, alright. So basically, that's the dengue duo test. Again, you'll encounter that in your internship. Very common test din sa laboratory. Okay, and it's usually, again, immunochromatographic kits, depending on the manufacturer kung saan na type of specimen. Na iba na serum, na iba whole blood, na iba plasma. So depende lang yun sa manufacturer. Always read the insert katong paper again na appeal sa mga kids. Okay? Alright. Ayan. Now for the next and hopefully the last video, we'll continue now with the last two types of agents, ilang serology, starting with parasitic and then finally your fungal agents. Alright? So I'll see you on the next video.